I'm Dr. Orly Avitzer with Dr. Sarah Song. Welcome and thank you for joining me.
Thank you for having me.
You are a stroke expert. Tell me a little bit about where you work and what it is you do on a day-to-day basis.
So I am a stroke neurologist at Rush University Medical Center in Chicago, and I see patients with all sorts of vascular neurology disorders such as stroke, aneurysms, bleeds in the brain. So I see lots of different kinds of patients in the hospital mostly, but also in the clinic.
Are you hearing anything new about the treatment of stroke or the diagnosis of stroke?
Absolutely. This is a very exciting time in stroke. A number of trials have recently come out over the last 6 months. And, it used to be traditionally that stroke was something that you couldn't really do much about. But as we're learning more, we're able to do more for patients who have acute strokes, such as anywhere from 20 to 50% of patients have what we call large vessel occlusions, the strokes caused by blood clots in the largest vessels of the brain, so the internal carotid artery and its branches. And traditionally, these patients don't do very well. Unfortunately, the strokes are large, and because the blood clot interrupts the blood supply to the brain, they can be very devastated. And in fact, these large vessel strokes make up the majority of the people who are disabled by stroke. However, in the last 6 months, we've learned that not only is there the medication called TPA, which is an IV medication given for patients with acute stroke within 3 to 4.5 hours of symptoms, and that was developed in the 1990s. Now we know that patients who receive IV TPA and who have large vessel strokes can receive another procedure called a thrombectomy, which is where a neurosurgeon or interventional neurologist or neuroradiologist can actually go in and actually pull the blood clot out if it's still preventing blood flow to that part of the brain. And they've actually seen that patients have done very, very well.
We talk about the treatment window with stroke and why it's so important for patients to get to the hospital in a timely manner. Can you talk a little bit about that and some of the signs of stroke that people should be aware of?
Absolutely. The one thing I want you to know is that time is brain. So when you have symptoms of a stroke, and that could be weakness on one side, numbness on one side, difficulty talking, slurring your speech, suddenly feeling dizzy or having vertigo, or having vision problems, so vision loss on one side or vision that seems to have double images. When you have those symptoms, you need to call 911 because time is brain. And when you call 911, the ambulance can recognize that you're having a stroke, and they can actually take you to a stroke-ready hospital. And when you get to the hospital, there's a medication called TPA, which I talked about. It's an IV drug. It can be given anywhere from 3 to 4.5 hours, and that medication can actually improve how well you do at 3 months and at a year.
Very good. Well, it's exciting that we have even more to offer now to patients, and that people experiencing those symptoms by going to the hospital can make an enormous difference in their outcome.
Absolutely, absolutely. Stroke, is a devastating disease, almost 800,000 strokes a year. But, with the advent of TPA in the mid-90s and the development of those stroke-ready hospitals called stroke centers, and now even more advanced hospitals called comprehensive stroke centers, stroke has actually dropped from being the 3rd cause of death to the 4th, and now even more recently the 5th cause of death. So we're really making headway, and I want people to know that stroke is a treatable disease. Get to the hospital, call 911, and you might have a better outcome than you would have 10 years ago.
Excellent. Thank you very much for being with us today.
Thank you for having me.